Lymph node biopsies. What are we talking about here? We're talking about a sentinel lymph node biopsy. Think of centurion, the guard. Sentinel then, the sentinel lymph nodes are the initial lymph nodes draining the breast of the lymphatic fluid. And the concept here is that sentinel lymph nodes can be positive in a patient whose lymph nodes are destined to be positive. In other words, if you're destined to be lymph node positive, then it makes sense that the first lymph nodes draining the breast are the ones that are likely involved. So that's one part of a lymph node biopsy. And there are techniques that I'll explain later about how we do sentinel lymph node biopsy when we're doing the primary treatment of the cancer. Now, another concept of lymph node biopsy is actually feeling an enlarged lymph node on the physical exam or seeing an enlarged lymph node on the breast MRI or ultrasound and actually doing a core biopsy of the lymph node up front way before we ever talk about going to the operating room. Now, why is such a biopsy like that important? Well, it helps us to know what the stage of the patient is, and it may well be a factor that would have us do upfront or neoadjuvant chemotherapy prior to doing any kind of surgery down the road. So the biopsies of the lymph node are important to us, and I'll talk later about removing the lymph nodes, called an axillary lymph node dissection, and how that standard is changing. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.